Good afternoon. Now we are all facing the COVID-19 unprecedented situations that has dramatically changed our society, including how we work. Work from home or telework is a dream of many people, including me, of course, in the past. However, such work arrangements has just emerged at the coming of the pandemic that may affect our work performance. I am Auditya Sutarto from the Department of Industrial Engineering with our team Santi Wardaningsih and Wika Harisa Putri. We come from different universities in Indonesia. Today, I will present our findings on the COVID-19 crisis and teleworking, a cross-sectional study on self-perceived stress and work performance. Today, our presentations will follow the structure, introductions, which cover why we study and research questions, the method, results, discussions, and conclusions. Work from home, telework, telecommuting, or remote work is an alternative work arrangement in which employees perform their job from home using information and communication technology to interact with others and complete work tasks. It was originally attributed to oil crisis in 1970s, and it gains popularity in Western and developed countries particularly. However, it is moving not so fast and suddenly experienced a rebound because of COVID-19 attack. On the other hand, work from home has advantages and disadvantages. For the advantages, including better work-life balance, reduced commuter time, more flexibility, improved productivity, lower occupational stress, etc. While disadvantages covers, for example, multitasking, decreased work motivations, distractions, limited communications, etc. However, in the context of COVID-19, employees were predicted to face more stressors due to, for example, increased work-life conflict given closings of schools and daycare facilities, and increased job insecurity and financial threats, because we know that global economic situations is not so good currently, and health concerns. Studies across the world about the telework and productivity results conflicting results. For example, Japan reported lower productivity, while USA reported 1 to 10% loss of productivity, slight decrease. On the opposite, Denmark, especially those who have manager level, Danish populations, 55% reported more productivity, while in China, although no productivity rate was reported, while those who are working at home receive higher job satisfaction and work engagement as compared to those who work at the office. While in Indonesia, we found only qualitative studies. They reported reduced performance among millennial workers and teachers. From Indonesian's perspective, such work arrangements is not so popular in our work organization because first, the perceptions that home is where people rest, while work is done in the office. And lack of technological support, dedicated workspace, and tools to do their job. The intensity of meeting and work interrelationships in Indonesian work cultures are very high. And of course, the gender role, where women do prioritize family over work and are the most responsible ones for doing domestic chores. And it may impact their work performance when they work from home. So, since the office-related stress has been shifting towards home-related issues, thus we come with our research questions. To what extent employee psychological well-being affect their work performance when they work from home during the pandemic? To resolve these questions, we assess we will assess three examinations. First, the prevalence of employee psychological well-being and their work performance. Second, the difference in psychological distress and work performance across some socio-demographic factors. And third, the relationship between psychological well-being and work performance. For methods, we conducted online cross-sectional survey with convenience and snowball sampling through our network. It was conducted 2.5 months after the Indonesian government had issued the regulation on large-scale social limitations. It's a kind of lockdown, semi-lockdown, semi-quarantine, I think, for other countries. It's quite similar. And we collected 472 valid response. Here are our sample demographic characteristics. Most were female, 58%, 36 and 50 years old, married, 85%, have 1 to 2 children, have a good education level, 49% at postgraduate level, work 10 to 20 years, jobs experience, work at private organization, 59%, and no dedicated workspace. To measure the psychological distress, we use the DAS-21, the Depression, Anxiety, and Stress Scale. It can currently assess symptoms of depression, anxiety, and stress, a well-known indicator of mental health. And we use the individual work performance, consists 18-item scale of 3 main dimensions: task performance, contextual performance, and counterproductive work behavior. Here, our summary of DAS and IWP. On average, we can see that each scale of the DAS, the respondents reported quite low. So we can see that the possibility range of value from 0 to 26, for example, for the depressions, and the respondents reported only 3.6. Well, for the work performance, respondent reported quite good work performance here. The task performance is 2.7, while the possibility range value 0 to 4. It means that they reported quite good performance, including counterproductive behavior, which it scales on the reverse side. And the second assessment, we would like to know whether any difference across some socio-demographic factors, and we found that most socio-demographic factors were related to the depression, anxiety, and stress, as shown here, that those who younger and single, no children, work at private organizations, have jobs experience less than 5 years, and no dedicated workspace reported more distress. However, for individual work performance, we found that most socio-demographic factors were not did not correlate with the productivity, except for the workspace. We perform structural equation modeling when we want to evaluate our path model. As shown in the table here, we can see that we conduct the CFA, confirmatory factor analysis, for the DAS and IWP. We found that they show good fit. And our path model, whether the that could predict the individual work performance, show the moderate to good fit. Here our path model. It is shown that standardized beta resulted minus 0.6. It means that one increase in respondents' mental well-being resulted in reduced performance about 0.6. In general, we found that psychological distress respondents reported less perceived distress and relatively good productivity. It's somewhat surprising for less perceived distress. It contrasts with other previous studies. However, it might be explained that our study was conducted at the later stage of the outbreak when uncertainty about the pandemic-related information already decreased. So it might explain why they perceive less distress, not as we predicted. For the occupation, for the good productivity, it might be possible that their occupation characteristic well suited to work from home, despite the respondents' lack of experience to adopt such a working structure in the past. Gender had no significant effect either for the psychological health and the productivity. It might be explained that our sample were knowledge workers. So whether either female or male, they had no difference. Female workers with better education, we can see from our sample demographic characteristic, postgraduate levels quite high, and employment could regulate their negative emotion. While younger reported more distress, it might be possible because they were lack of life experience and maturity to cope with life problems as compared to their older counterpart, although their risk of contracting the disease, the COVID-19 disease, is relatively low. And marriage, those who married perceive less distress because studies shown that marriage providing the emotional, financial, and social support when an individual faces the crisis. Our study was inconsistent with other previous studies. Not interestingly, not as we expected, that those who have children will reported more distress, but in our study, on the opposites. It might be explained that the parenthood issue seemed to be much easier than at the early stage of the pandemic. We conducted study in June and July, where the school are on a public holiday, and about 5 months after the first case of Indonesians COVID was announced. So maybe parents, maybe the increased work-life conflict was not so high as we predicted. And those who had least jobs experience perceive more distress. It implies that more extended employment, I mean, those who work longer, is commonly associated with more social supports and responsibility for their work, so they reported less distress. While work in private organization, as we expected, they reported more distress Due to the global economic situation, those who work in public feels more secure, while the others show while the counterparts work in private organizations show the opposite. It means that job security play a critical part in their mental well-being during the pandemic. We could not find the significance work performance across most socio-demographic factors. It might indicate that the magnitude of distress was offsite while working at home, as shown by participants' low level of psychological distress. And yes, our PEF model show that the teleworkers' mental well-being influenced their productivity during the pandemic. It supports a previous study, a model by Donald, that the psychological well-being is the strongest predictor of self-rated productivity. Of course, our study has several limitations. First, it was a cross-sectional design with self-administered online questionnaires with the consequence of selection bias and race representativeness and generalizability issues. Second, our small sample size restricted us from building a moderation model or analyzing multiple group comparisons. For example, we could not analyze whether the younger respondents who reported more distress will reported less poor productivity than their older counterpart. And we did not include work-related stressors, so we assessed the prevalence of distress, but we did not analyze whether the work-related stressor can be included in our study. And as our study conducted in June to July, different results will be expected at different survey time period because Indonesia has just entered recessions on September. Teleworking will be a new normal after the pandemic, as predicted by the OECD. And ILO also estimated the potential for teleworking in middle-income countries, including Indonesia, close to 16% after the pandemic, before 8%. So what can organizations may organizations take advantages to the current work structures? First, they may identify individual or occupational characteristics that provide the most impact on productivity. This is also our study limitations. We did not include, we did not ask the respondents' job professions or position because it may result in different different outcomes. And organizations may also develop proper strategies to improve employee psychological health and overcome telework challenges. And how about the teleworkers itself? They might create home office space and invest supporting infrastructures because it will be a new normal after the pandemic, and the practice of teleworking, I think, will be continuing. Work from home is a dream, but it might be a nightmare since everything's going to be worse. However, our study show the contrasting fact that teleworkers reported less perceived distress and relatively high work performance. And more socio-demographic factors plays essential role in psychological health, but not in work performance. The availability or dedicated workspace influence both psychological and performance outcomes, and psychological well-being was a strong predictor of work performance in the context of the COVID-19. Last but not least, let me borrow a quote from Rod Whitman that time is valuable and telework is a viable component to help improve quality of life in many ways. Thank you very much.